I think it's...
Thank you, Kate, and thank you, Joanne. Thank you, everyone here, for being here. I feel humbled and not deserving to be up here with all of such highly educated, well-spoken, and well-researched people. I've been a police officer. I just retired, but I started being a police officer in 1982. And at that point, the United States, and then to a certain degree, and more so later, the world, had begun the war on drugs. And although we know that traditionally, regardless of the gender, regardless of the orientation, regardless of the culture or the race, the rate of drug use is consistent, about the same through all of those cross sections. However, we did see that throughout the nation, and certainly in the city of Seattle, our drug enforcement policies were primarily focused on the street, not on those who were dealing, using, or addicted behind closed doors. And it was the street user, the street addict, or the street seller that caused usually very little violence. In fact, we found that for the most part, very little violence is ever caused by the street level drug dealer. Although they did cause a lot of disorder, visible disorder, or what some call social disorder, which ended up generating a lot of complaints and demands from the businesses and from the public and from the residents that we arrest these people. So over the years, we continually arrested over and over some of the same people. And if it was not the same person, if we did arrest them, and they would go to prison, then their sellers or the users would just be replaced by a new group of people. And although the city of Seattle is only made up of 8 to 9% of African American or Black people, our arrest rates were 75 to 80% African American people. So the disproportionality was significant. We thought that we were doing the right thing. We were making our arrests. We were doing it according to the law, and according to what the governors or the president or the legislatures had said was legal. We would give it to the prosecutors, they would prosecute, the judges would convict, and the jailers would jail. But we weren't thinking about whether this was working or not. And clearly, now that we examined what we were doing, it really had no result. The price of drugs continued to go down. The availability of drugs continued to remain more or less the same. And the drug or drug use fluctuated somewhat, but it remained consistent. So we were pouring all this money not only into enforcement and to jailing people and prosecuting people, many of which were key populations, whether they were homeless, some were mentally ill, some were addicted, some were co-diagnosed with HIV or hepatitis C, or any number of factors that would identify them as a key population. We were also spending a lot of money defending our actions by hiring attorneys. And what that means is there were many civil society groups. In Seattle, it was the American Civil Liberties Union, the Racial Disparity Project, which was an activist group that was trying to reduce disparities and discrimination and disproportionality, not only in law enforcement, but in housing and education, and also the Defenders Association, a group of attorneys that traditionally defended the people that we arrested. So we would spend a lot of money not only on the enforcement, but on defending our practices. This went on for years and years and years, and we got nowhere. Eventually, one captain asked one of the leaders of of the Defender Association, what would you do to reduce this drug dealing and visible disorder in response to all the complaints? but also reduce the disproportionality. And she said, I don't know. That began the conversation, and which eventually led to the law enforcement assisted diversion, or LEAD. The LEAD began when all of the people who in any way was involved with the arrest, the prosecution, the defense of, the jailing of, the probation, the treatment, the housing, anyone who had in any way of a influence on any of these key populations that we policed, we all got together. And it took a long time to reach consensus, to come to a basic protocol and policy where at point of arrest, not at point of booking or point of prosecution, which other programs have tried, but our effort consensually was to not even get the person in jail, not get them prosecuted, and not get them in front of a judge. Because by the time any member of that key population has become that deep into the criminal justice system, it's much harder to get them out of it. And the downstream costs, whether it's lack or inability to get an education, inability to get housing, inability to vote, or any number of the rights that people enjoy in the United States, those are greatly diminished. So our point was to get these people, or try to keep them out of the criminal justice system, try to get them help. So generally, what this was anyone who at point of arrest, who had 3 grams or less of a controlled substance, who was not violent, who was not predatory, and who was willing to work with the police at point of arrest, that police officer calls a prearranged number, and a case manager comes up to the police building and immediately conducts an initial assessment to determine what the immediate needs of this key population person is. Within 30 days of that initial contact, that person has to conduct or be involved in a much more thorough assessment to determine mental health needs, hygiene needs, addiction needs if they're addicted, housing needs, education needs, job training needs. At the present time, this is all funded by private groups, mainly the Ford Foundation and Open Society Foundation. It's been going on for 4 years. We have expanded it from a relatively small geographic area of Seattle to a larger one, about 3 times the size. And it is initially showing enough promise, enough success, that the city just allocated more money to the program to expand it and to expand the amount of case managers and training and treatment that has been hoped for. There are about 195 people involved in the program. It's being assessed now for ability to save money, for efficacy. It's being researched by the University of Washington. One key point, though, is it's not an abstinence model. It's a harm reduction model. It's not like other models in the United States where you cannot use drugs. We, as a group, understood that it took these key populations years to become involved with drugs and the street life, and you can't expect them to get out of it immediately. Although it's controversial, it is showing some promise, and so that's a law enforcement assisted diversion. Thank you again for letting me present.